Today's webinar is sponsored by RBC Wealth Management. Joining us today are Patina Nation's 401k advisors, Kyle Leopold and Jonas Edstrom. Thanks for joining us today, guys. I'm going to turn the event over to you to speak about the Patina Nation 401k plan and introduce today's guest speaker.
Great, thank you, Jesse. Kyle Leopold here, along with my partner Jonas Edstrom. We are very excited to bring Ryan Bostwick from Transamerica on today's call. I've personally listened to Ryan a number of times on Social Security and Medicare, and I'm very impressed, and I believe everybody will take something very beneficial from today's call. A little plug for the Patina Nation 401k plan. If you're not familiar with this retirement program that Patina Solutions has created, it is a very competitive retirement plan. The 2019 limits, contribution limits, are $19,000 for the year 2019. If you're over age 50, that's an additional $6,000. And you also are able to contribute as an employer if you are a sole provider. So the limit for 2019 can go up to $56,000. We have hired two other companies for administrative tasks, a company called Tag Resources, which does all the administration for the plan, and we've hired a company called Mesero for a fiduciary on the fund lineup. So there's very little administrative task as you as a participant, and it is in compliance with all government regulations. Well, I'll turn it over to Jonas for a brief few points.
Yeah, so you do have limited fiduciary liability increase, and as Kyle said, the plan comes with a very competitive cost. The third item I'd like to review with you is the wealth plan. We would like to offer you the opportunity to have a personalized wealth plan created for you. If you already have one, use our resources for a second opinion. The individual RBC wealth plan will cover your wealth needs to retirement and through retirement. Our wealth plan will not just cover investments, it will also cover estate planning and taxes.
So as you can see, it's the Patina Nation 401k plan is great for the tax benefits and as well as a personal financial planning opportunity. So we really appreciate the opportunity to work with Patina. And I think if you have interest in learning more about this, please reach out to Jonas or I. You can see our emails there, kyle.leopold@rbc.com or jonas.edstrom@rbc.com. And of course, you can visit the Patina Nation website, patinanation.com, for more information. So I'm going to turn it over to Ryan here. One thing I would like to add before my time is up is if you do have interest in a free Social Security maximization report, Ryan will touch on this as well at the end of the presentation. But if you have interest in getting your personalized report on your specific situation, please feel free to reach out to us for that as well. All right, and without further ado, here's Ryan.
Thank you very much for the introduction, Kyle. Thanks to everyone who's joining us on today's webinar. I am very, very excited to be here, and we've got a lot of information to cover in a very limited amount of time. So I'm going to go ahead and get started right away. The flow of this is going to work this way. We're going to start with Social Security. We're going to transition over to healthcare. And if you remember anything from today's call, it reinforces the opportunities in front of you to take care of your own financial planning needs. When I start Social Security, I'd like you to think about Social Security in this way. The program was started back in 1935, and the purpose of the program was to replace 35% of the average worker's pre-retirement income. And while I've skipped ahead a few slides in our slide deck today, those were historical slides that aren't going to serve a lot of purpose for you in the context of your planning. But we're going to talk a little bit more here about how Social Security ultimately ties in to your retirement planning. So going back to it, in 1935, the full retirement age of 65 was established. It was established to allow the oldest American workers to spend the last few years of their life outside of the workforce. The purpose, again, was to replace 35% of the average worker's pre-retirement income. And all these years later, almost 9 decades later, the program itself has lived up to that. In 2018, Social Security replaced, on average, 33% of the average worker's pre-retirement income. But if you notice the slide that we're on, Social Security was built, to use a term that's used in Washington often, to be fair. What that means is, if an employee was making $100,000 a year, Social Security doesn't automatically give them $35,000 a year because that's the ratio they had sought out for. What you can see on the slide is it was tilted to benefit lower earners. For the average low earner in this country, Social Security replaces 75% of the average worker's pre-retirement income. That's the reason why almost all American workers at some point in their life find them retired. But I'll spend some time today talking about my father. He's a 69-year-old baby boomer. And in my dad's case, Social Security replaces 16% of his pre-retirement income. And hopefully that's understandable in the context of the way that it was built to, again, benefit all Americans and allow all Americans to retire. Here's a short list of the questions that we're going to try to address today. The last 3 are the most important areas as you go through your planning. I've been told one constant thing about Social Security my entire life, and that one constant thing is it's not going to be there. So let's address that real quick. Our own government, every single spring, gives us a state of the Social Security budget. And here's what they said most recently. The reserves are projected to pay full benefits until the year 2034. That doesn't mean that Social Security will cease to exist after 2034, because the only way that Social Security can cease to exist would be if our federal government stops collecting payroll taxes from workers. And hopefully everyone on today's call understands the chance of that happening is very, very small. So they go on to state that they can pay full benefits through 2034. After 2034, all the way until the year of 2092, they anticipate being able to cover 77% of all benefits that have been promised, even if no changes are made. Now, I don't know what your plans are for the year 2092, but chances are I won't be around to see those days. So I'm not 100% certain why they stopped their forecast then. But long story short, Social Security projections are a lot more half glass full than they're half glass empty. See, at the end of the day, the biggest challenge facing Social Security is really this. I rhetorically ask all of you on today's call, how many of you have parents who are still alive receiving Social Security benefits? If I'm speaking to a live audience, about 40 to 50% of the hands in the room would go up. And I'm sure it's very similar on today's webinar. See, the real challenge facing Social Security is that it was never meant to pay 2 generations of the same family benefits at the same time. That's the ratio of workers to retirees that you're looking at on the screen there. As far as proposed changes, I would tell you any reform to Social Security is slow moving. Here are some of the projected changes. Keep in mind, some are politically speaking easier than others, but I'll move off this slide with a question. What do you remember happened to your Social Security benefits on April 20th of 1983? You probably don't remember, and it's because you weren't thinking about Social Security in April of 1983, but that's the day that your retirement age, which started at 65, was raised to something above 65. And why is that important in today's conversation? At your full retirement age, you are granted your primary insurance amount. To qualify for Social Security, a person needs 40 credits for full eligibility. That's 10 years in the workforce. Once you qualify with 40 credits, they no longer count credits. It's not a race to build the greatest number of credits in your work history. After you've qualified with 40 credits, they use 35 years of your work history in which you earn the most. So let me take an opportunity to clarify that real quick. Here's what it means. If a person worked and had 41 years of work history, Social Security is going to use the top 35, all adjusted for inflation. Now, if a person were to be a few years short of a 35-year work history, let's say that they have 30 years of earnings in, people ask, well, what do they fill in for those other 5 years? The answer is 0. And in the context of this calculation, it's not like golf where you want your number to be low or your average to be low. You want high averages. One of the most common questions I get asked about how they determine your eligibility is this: what happens if I take a part-time job in retirement? Think of one of those jobs that you yourself might aspire to have. If you like golf and you think that your spouse might give you a lot of grief for spending too much time on the golf course, you may choose to get a part-time job at the golf course. If you really like hunting and fishing, right, you can get discounted gear if you work at a company like Cabela's or Gander Mountain. I hope you understand where I'm going with this, but the point is you can never reduce your Social Security benefits by working part-time in retirement. Going back to my examples, if you have 41 years in, they're still going to use your top 35. And if you don't have 35 years in, that part-time work would actually start to replace zeros, which means what? Your benefit can continue to grow through post-retirement work. Now, since 2010, many people don't feel like they've seen a recent statement. In 2010, they stopped mailing out those Social Security statements to individuals that they had sent to us our entire lives. Due to public outcry, they brought the mailing of those statements back in 2012. If you are 60 or older and do not collect benefits or have an online Social Security account, you will get a printed statement every year. Those who are under 60, you will receive a statement every year in your life that ends in a 5 or a 0. We have listed conveniently for you the ssa.gov website. We would encourage all attendees today to make sure that they've registered online with the Social Security Administration. Keep in mind, once you have an online account, they do update our personal statements every year. Quite often, people want to know, what is the maximum benefit that you're allowed to receive if you collect Social Security? Well, we have the numbers up there. For a person who maxed out their payroll tax obligation every year for 35 years, in 2019, they would be receiving at full retirement age a monthly benefit of $2,861. You can see where the average couple receives the average worker, receives $1,461. The average retired couple is receiving $30,000 a year for Social Security benefits. And so remember at the very beginning where we talked about how the program was to be built fair, consider that the average couple in America makes $46,600. You can see that Social Security replaces well more than half their benefits. I'm going to ask you to visualize your statement. If you haven't gotten one in a while, it gets mailed to you. It's 2 pages, double-sided on both pages. It's 4 total pages, and on the very first page, in the upper left-hand corner, there will be a number. That is your estimated benefit at your full retirement age. There's no other useful information on the very first page of your statement other than that number. Now, once you open it up to the second and third pages, that's where all the fun stuff is. And the very first line will say at FRA. Again, if you don't know when your FRA is, we're going to view a chart here shortly, but it's written on your statement inside of parentheses in terms of years and months. That will then list a dollar amount benefit that is the exact same one on the first page. You can receive reduced benefits. Please keep in mind that all Americans are eligible to collect early Social Security benefits at age 62, even though Americans have different full retirement ages. And the latest that anyone would wait to start collecting Social Security benefits is age 70. That will make more sense as we go through the next few slides. As I promised, here's a chart that shows you based upon the year you were born when your full retirement age is. Take note of all of those people born after 1960. Do we think that at some point they may raise the full retirement age again? Absolutely. What group of people may be adversely affected by that? It would be that group that currently has a full retirement age of age 67. Now, the question that I like to ask is, how long will you receive Social Security benefits once you start them? And it's not a trick question. The answer is for the rest of your life. That is the reason why, if you file early at 62, you receive a reduced benefit from your primary insurance amount. If you're a baby boomer and your full retirement age is 66, you would receive 25% less. But the reason again is you, by definition, will receive 48 more payments during your lifetime. One common question, since most of us don't choose to retire at the end of the year, we retire throughout the year, I'd like to set up this slide this way. Every July, I speak to one group of professionals about retirement. And that group of professionals, of course, is educators. The school year quite often ends in June. First month of retirement would be July. And the question that they ask me goes like this. Ryan, from January 1st through the end of June, I made substantially more than $17,640. Does that mean that I can't collect Social Security and I'd have to wait till the following year? Keep in mind, in year one of collecting, the Social Security Administration will only start to look at income you've earned starting with the first day of the month that you would collect your full first payment in. So going back to the example, they would start counting your earned income July 1st if we were to assume you'd receive your first payment. That income limit only applies to people who are under their full retirement age. Please notice that once an individual hits their full retirement age, there is no longer an income limit in terms of limiting what you can make and ultimately therefore collect. To make sure that we're giving you example, my father, full retirement age was 66. On his 66th birthday, they stopped counting his income, even though he still was working as a medical doctor, but he was able to turn on his Social Security benefits and nothing additional was going to be withheld. If I surmise there's a question for someone out there on the webinar, the question probably is this: what counts as income in that limit? Keep in mind, you all know that capital gains can count as taxable income, dividends, interest, certainly earnings. My mom worked for the state of Wisconsin. She receives a pension. Pension income is taxable income. The answer to your question is this: if it's $1 of income that you earn, that you pay payroll taxes on or the FICA tax on, it counts. And if you don't pay payroll taxes on that $1 of income, it doesn't. So it is primarily going to be a number that's determined by wages, tips, and earnings of the individual collecting. Now, if you read any article recently about Social Security, it's going to tell you to wait. And in today's low interest rate environment, an 8% increase to your Social Security benefit sounds pretty good. But yet 72% of Americans collect Social Security prior to Medicare eligibility. Only 3% of individuals wait till 70, even though this slide tries to make the argument that more people should wait than maybe do. This particular chart starts to allow us to talk about strategy. And the easiest way to think about it is this: if you know with great certainty that you will not be alive by age 78, it tells you you should take Social Security early at 62. But if you believe that you're going to live forever, or maybe just till 82 and a half, it tells you that you should consider waiting no longer than age 70. And if you plan on dying, as most people do, somewhere around life expectancy, in this case between 78 and 82 and a half, it really didn't matter how old you were when you chose to collect. Again, the program did not set out to build a perfect age to collect, because if they had done that after 9 decades of being around, we would all know that age. It's an actuarial-based exercise. Now, the one thing I don't like about this chart is it's too simplistic. Of course, most of us do not know when we're going to go. But what I mean by it is this is a great break-even chart for a single individual. But for any of us who are married, the question that needs to be considered is, well, what happens to your benefit when you die? My wife got a recent Social Security statement, and on that statement, it suggests that at her age of 67, she will collect $134 a month. That's her personal benefit. My benefit is worth substantially more than that. My wife will receive my payment should I precede her in death. And why am I bringing this up on this slide? Here's why. Men in my family are not long-lived. I could be somewhat pessimistic some days. And let's say that I know for a fact I might not live age 78. My initial reaction, and hopefully your advice to me, would be go ahead and collect early. And that would be fine. But I need your help with this one. My wife's great-grandmother lived to 104 when no one lived to 104. Her father was in Pearl Harbor and lived to 89. Most of his peers didn't live to 89. The question that I have for you is, why do you think my wife's grandmother isn't buried in the same cemetery with her husband? And I know it's an odd question, but I wanted to make sure that you're thinking about this. The reason is my wife's grandmother isn't dead. And that's why she's not buried. Where am I going with this? My wife's family has tremendous longevity. And while I may be pessimistic about my own health, it's important to take into consideration that my wife will take over my payment when I'm deceased. And so that may be a lot of reason right there to consider delaying. Obviously, if you are chronically ill, it's a lot harder to hold off on taking Social Security. Again, a single individual, when you die, the benefit dies with it. No beneficiaries will receive your payment after you're gone. They do provide you with a whopping $255 death benefit. So I brought up my wife, and the way that spousal benefits work, spousal benefits apply to my wife and I while I'm alive. That's an important distinction. My wife would only receive spousal benefits off of me while I'm alive. Because as we just discussed, my wife will take over my full payment upon my death. Remember how I told you that my wife is estimated to receive $134 a month at her full retirement age? Well, the good news for us is she gets the greater of that or half of mine. Half of mine in our case is going to be more. Of course, my wife would have to be 62 or older to qualify for benefits. Why? Well, that makes perfect sense. I have to be 62 to collect my own. Now, keep in mind, because we're married, she cannot collect on a spousal benefit until I've done one thing. Some of you might be thinking retire. The actual words are, I have to file for my benefit. Some of you on the call might remember that 3 years ago, Social Security, a big filing strategy went away. That was called file and suspend. That strategy applied to couples just like my wife and I. See, I was going to be able to file for my benefit, suspend the payment, and that would allow her to collect. Now that that option is taken away, the only way that she can start collecting spousal benefits off of me is if I collect myself. That has caused my own time that I'm planning to take Social Security to go from age 70 and fast forward it to age 67. Why? Because the only way that my wife can receive spousal benefits off of me is for me to collect. But let's talk about my mom and dad real quick. My mom and dad got divorced a long time ago. But the reason why I bring it up is they were married for over 10 years. My mom, as an ex of my father's, is still eligible to collect Social Security spousal benefits off of him. The only difference between a divorced couple and a married couple is my mom does not have to wait for my father to collect before she's eligible to collect the spousal benefit. She simply has to wait for him to be eligible to collect, and then she's able to collect the spousal benefits. Now, to confuse you just a little bit more, my father is married for the second time. So he's got an ex-wife and a current wife. And the question is, who of those two individuals is able to collect Social Security benefits off of my father? The answer is both, and they don't share the benefit. While my dad's alive, they're both eligible for spousal benefits off of him. When he's deceased, they both stand to take over his full retirement age payment. Again, the 10-year rule that a lot of people refer to when it comes to Social Security is only in the case of divorce. When it comes to marriage, it's a 1-year rule. I'm going to finish our Social Security portion today with a few examples because it's really helpful from past experience to hear or see a few examples that you might be able to equate yourself to. So here we have the Roosevelt family. We've got Frank and Ellen. Frank was the higher wage earner in the example. And they want to get benefits early on because they, like a lot of Americans, plan to retire early. And not only that, they know that chances are they'll be the healthiest and most active in their retirement at the beginning of retirement. Now, Ellen is a candidate for spousal benefits. Notice her own benefit is worth $600 a month. His is worth $2,600 a month. She would stand to collect $1,300 as a spousal benefit. But because they're married, she cannot collect off of him until he files. So notice in the example, she's not able to start collecting spousal benefits until Frank files at his full retirement age. Now, Ellen would be able to collect the benefit off of herself early and then transition to the spousal benefit off of her husband, Frank. And we've laid that example out for you on this slide. I'm going to finish and just transition to a different page. And during my transition, Kyle mentioned at the beginning that we are able to run a Social Security maximization report for you. So we wanted to show you this, and I'll just run scenario in the essence of time, but here is what we mean. I want to run a scenario that's near and dear to my household. We have a husband who was born in 1950, a wife who was born in 1962. Please note the age difference. That is a great variable that adds to our Social Security conversation today. At full retirement age, he stands to receive $2,700 a month. Her full retirement age payment is $1,600 a month. We hit calculate. That's all the information we would need from you is your full retirement age estimate and your year of birth. It automatically plots out for you what you would anticipate collecting at the primary ages. But on top of that, it allows us to put together any custom strategy that may be tied to your financial plan. Let me give you one quick example of this. I just clicked a few buttons and we're now able to change. And what I was trying to show is that even though conventional wisdom says they both could wait till 70, and if they're lucky enough to live forever, they would collect the most that way. Notice that because of the age difference, the report actually suggests that she collects at either full retirement age or maybe even better yet at age 62. Because keep in mind, with her being 12 years younger, the actuarial assumption is she will survive him by about 13 or 14 years, okay? Let me transition to healthcare this way. Social Security estimates, and maximization, it only tells part of the story. Again, if you plan to retire early, prior to Medicare eligibility, the number one question I have for you is not, should you take Social Security at 62 or not? The real question that I have for you is, what are you going to do for health insurance if you're retired and not yet 62? This is healthcare.gov, and this potentially applies to any person who finds themselves without insurance but under Medicare eligibility. I'm going to run you through one scenario. I'm going to use my home zip code. We're going to run this for a 62-year-old couple. By the way, any of you on the call, this is the public website, would be able to go peruse this yourself. We've got a 62-year-old male. We have a 62-year-old female. Now notice the very next question is, what is your expected income? Let's show you two numbers real quick. $66,000, number one, tells them that neither one are eligible for a tax credit or subsidy. Now see, you might not want to collect Social Security if it increases your taxable income. In Ozaukee County, where I live, take a look at this. The least expensive plan for a household of two with income above $66,000 for this year is $1,704 a month. And if that's not bad enough, take a look at the size of that deductible, $15,800. Why are we sharing this with you? Let's change one variable. We're going to make $66,000 $65,000. And let's take a look at what happens to the pricing. Notice that by reducing their taxable income by just a modest amount, certainly a lot less than someone's Social Security benefit, that's now the new tax subsidy. There is the new cost of insurance. We shared this with you for two reasons. You will have or potentially might find yourself without access to insurance prior to Medicare eligibility. This fills a void. On top of that, it helps you understand the importance or the net effect of collecting Social Security, that it can't be viewed only in the Social Security lens, but quite candidly, that it's all part of the financial planning process. Said simply, the new premium, by the way, in case we're following along, is 68 cents. It went from over $1,700 a month to 68 cents. We still can't help you with that big deductible, but keep in mind, premium is for spending whether you go to the doctor or not. Deductible is more of a consumption spending, and hopefully that makes sense. We're going to finish, and thank you for your patience, with a little bit on Medicare. And I'm going to set it up this way. I recently spoke to a doctor, and during that conversation, the doctor asked me, are there really 17 different choices when it comes to Medicare? The answer is no. I asked him where he got the number from. He told me that was the number of Medicare brochures that he had received in the mail in the last month. Your mailbox will need to get bigger when you become eligible for Medicare. And what Medicare represents is certainly retiree health care, but what it also represents is no longer needing to work primarily for health insurance purposes. We're going to make Medicare super simple for all of you today. There are not 17 choices. There are two choices when it comes to Medicare. I keep referring to my father. He still works as a primary care doctor at a big hospital system. And yet my dad has been on Medicare for 3 years. Why? Cost benefit analysis. It's not conventional wisdom to look outside of an employer for health insurance while you're still working. We want to stress that it's something that all of us should look into when that time comes in our life. I'm sure you're all very familiar with these key terms. They apply to all health insurance. The decisions, again, are yours. When you're 65 or older, it's your choice to choose where you get your health insurance, through an employer plan, your spouse's employer plan, or through Medicare. Original Medicare is the Medicare system that your parents and potentially grandparents retired to. The health insurance provider, when you're on Original Medicare, is the federal government. And you purchase two parts of your Medicare insurance through the federal government. You are also, by law, required to buy prescription drug coverage. That is Part D coverage. And then you have optional Medigap insurance. The only alternative to Original Medicare is this thing called the Medicare Advantage plan, or sometimes also referred to as Part C. I'll say it again, but to be clear, you will only be on Original Medicare or a Medicare Advantage plan. You will never be on both at the same time. This is the same example just showed or illustrated in a little bit different way. Medicare Part A is fantastic hospital insurance. How good? After a $1,364 deductible, they cover the first 60 days in full. 41 years of being a primary care doctor, my dad has never had a patient exceed 60 days in a hospital stay. Should you be so unfortunate, there are 60 lifetime reserve days that you are also able to tap into. But please note that Medicare Part A applies to all care that's coded as inpatient hospital care. Notice that it does touch on skilled nursing care. That does not mean that there is a long-term care benefit. That would be rehab up to 20 days provided to you with no cost. That's consistent with a hospital stay that lasted for 3 days or longer. But long story short, it's really good hospital insurance. Medicare Part B. I'm going to digress for one quick second. Medicare Part A is the only part of Medicare you might be on while you're still insured by an employer-provided plan. A lot of Americans believe they have to sign up for Part A or face penalties if they don't do it right away. The only people who have to sign up for Medicare Part A right when they turn 65 would be people who are participating in low deductible plans. Said simply, if you sign up for Part A and it causes you to lose the right to contribute to a health savings account, you do not need to sign up for Medicare Part A. If you're not contributing to an HSA, go ahead and do it right at your 65th birthday. You would not sign up to any other part of Medicare until you are separated from an employer-provided plan. Medicare Part B is the second building block of Medicare. This provides or gives you coverage for all non-hospital related bills. Please notice the annual deductible of $185. Standard monthly premium is $135.50. But please keep in mind that it is an income-based premium. The more taxable income you have, the higher your Medicare Part B cost could be. Here is that chart. Please note that when a person in a household dies, that surviving person goes from being a joint tax filer to a single tax filer. That death of a loved one may actually increase the household cost of Medicare. Not only are you lucky enough to pay a higher Part B premium if you have high income, you're also lucky enough to pay a higher Medicare Part D, as in drugs premium as well. These are not covered by original Medicare A and B. Prescription drugs, as I mentioned, have been required to have by law since 2006. The average prescription drug plan in America is $32 a month. If you take more expensive drugs, you probably will pay more than that. If you take less expensive drugs, there is something, at least in the state of Wisconsin, called senior care. Of course, many of you from outside the state check into your own state programs as well, but the premise of senior care is it's a great low-cost solution for drug coverage for people who don't take expensive drugs. When it comes to out-of-pocket costs, any potential out-of-pocket costs, or most of it, I should say, is related to the donut hole. The donut hole is currently being filled in, and eventually the donut hole should no longer exist. That was all part of the Affordable Care Act creation. Medigap insurance. The purpose of Medigap insurance is to cover what Medicare Parts A and B does not cover. Remember, the only time you'll purchase Medigap insurance is if you are getting your primary insurance through the government through original Medicare. Most people purchase Medigap Part F policies, and you can see on this slide as to why they purchase Medigap Part F. It fills in all the holes. So we're going to finish before our Q&A with Medicare Advantage Part C. It is the alternative to original Medicare. What's the easiest way to think about a Medicare Advantage plan? It's very relatable to the plan that you got through an employer. You are going to have a pre-negotiated network of doctors. Keep in mind, original Medicare, you don't have a network of doctors, but when it comes to an Advantage plan, you may. You will get all of your insurance through that private insurance company that offers you the Advantage plan. And much like the plan that you might be currently familiar with, you're going to have a stated copay, a deductible, and an out-of-pocket maximum. 20 years ago, very, very few people did Advantage plans because it allows for less certainty about healthcare costs when you go to the doctor. But to be clear, most of us are going to spend most of our retirement healthy until all of a sudden we become sick and then really consume a lot of healthcare, as opposed to being sick for 20 or 30 years of retirement. So we're not here today and in closing to endorse original Medicare or a Medicare Advantage plan. But we will tell you this, that in 2018, 67% of the public did original Medicare, A, B, plus a drug policy, plus Medigap insurance. If you bought that fully loaded Medicare, it would cost about $350 per person per month. A Medicare Advantage plan is going to be a lot closer to $140 per month. So from a monthly cost perspective, that's the primary advantage. But as I mentioned, it allows for less certainty about the bills on the backside. As employer-provided insurance has gotten worse and worse, as networks have gotten smaller, as deductibles have gotten higher, the negatives or the perceived negatives of Medicare Advantage plans aren't quite as negative as they used to be. I believe that in 10 years, half of retirees will be on Medicare. My closing statement about Medicare is this. Every year you are able to switch from one of the paths to the other. You can go from original Medicare to an Advantage plan. You can go from an Advantage plan back to original Medicare. But please note that if you are uncertain on what to do right at your first year of signing up, we would encourage you to think about original Medicare with a Medigap policy. And the reason is because on year one of signing up, you are guaranteed issuance of a Medigap policy with no medical underwriting. Whereas if you choose to start in an Advantage plan, switching back to Medicare only works for you if you're able to purchase a Medigap insurance policy. And after year one, it becomes a medically rated policy. So you would have to switch that way when you're healthy. With that being said, I'm excited to take questions that those of you have for me.
Great. Thanks, Ryan. That was very informative. I believe Kyle has some questions lined up for you all, and I'll let Kyle take over.
Great, thanks, Jesse. Yes, we're getting a number of questions coming in on both Social Security and Medicare. And as you can see from Ryan's speech on the topic, I think this conversation could probably go on for another hour. But thank you, Ryan. The first question we've got here is, my husband is 7 years older, but I will have a greater Social Security benefit. Does it make sense for us to collect under him starting before FRA, full retirement age, and then switch to me when I'm at full retirement age?
That's a really, really good question, and thank you for sharing it. Yeah, in the example I used, we had the older person be the one with the higher benefit number. And I'm going to try to speak as clear as I can. If we're going to hold off or defer taking one of the two individuals' benefit, I think we all understand that it's beneficial to hold off on taking the higher or the larger of the two benefits that was coming into the household. So to answer the question directly, if your husband has the lower benefit, it's less important to hold off on taking that one, especially if it provides a benefit to your financial plan today. Please keep in mind, you're the younger worker in this example. Your benefit's the higher one. Upon the passing of either one of yours, your benefit is the one that gets taken over by the survivor. And so if we're going to choose to hold off on one of the two, we would hold off on yours.
I'd also just like to add, if any of you would like, again, a personalized maximization report specific, just like this example, feel free to reach out to me, kyle.leopold@rbc, and we'll have these run for you through Ryan's office.
Absolutely.
This is a great candidate for that. Second question, can my spouse file for her own Social Security benefit at 62 and me file for spousal benefits, and then switch over to my higher benefits at my FRA or 70?
Great question, and I'm glad someone asked it. Frankly, I knew someone was going to ask it. So what you're referring to in your question is something called the restricted application. For any of you who want to do a quick Google search of a restricted application, here's what you will find. the only Americans who are still allowed to do that exercise, and this is due to the change of Social Security filing strategies by the 2015 Bipartisan Budget Act, you had to be 62 by the end of 2015 to be grandfathered into that restricted application. Said simply, if you weren't born in 1953 or sooner, you are not able to do it. So to answer the question directly, if you were born prior to 1953 or in 53, we would definitely want to run a Social Security maximization report to show you how that works. But generically answering the question, most Americans, and certainly most on the call today, will not be able to do what was suggested in the question.
All right, another question here. I thought the spousal benefit went away unless you were born before January 1st, 1954. That's
again a question related to the Bipartisan Budget Act. So generically speaking, you are automatically granted the higher of the two. That would be the higher of your own or the spousal benefit, which again is 50% of the higher wage earner's benefit. So I'm going to give you an example. Let's say that you have a household of two. They're the same age, they're both 62. The lower wage earner, because the higher wage earner hasn't turned on Social Security yet, the only benefit the lower wage earner is eligible for at that moment in time is their own. So yes, the person could start by collecting their own benefit. And then somewhere down the road, when the higher wage earning spouse turns on their own, a person can switch from their own benefit to the spousal benefit and ultimately get a pay raise. But if the spousal benefit is already eligible, the Social Security Administration compares your own to the spousal benefit and you automatically get the higher of the two. Thank you for the question. Good clarification.
Here's another common question, Ryan. My husband worked for the federal government. What is the offset for Social Security?
This is a hard one for people to take when they're in this situation. So let me give you an example. Let's say that we had a person who worked their entire career for a certain part of the federal government. If they go back and review their paychecks, they will notice that they never paid a FICA tax or contributed to the Social Security system. Instead of receiving Social Security, they're going to receive a federal pension. This also applies to a lot of postal workers, by the way, that we do planning for. So the question is, well, I understand that I might not have qualified for my own, but can't I draw spousal or survivorship benefits off of my spouse who did not work for the federal government and did pay payroll taxes? Unfortunately, your federal pension subjects you to the federal pension offset provision, and you may not be able to collect Social Security. My mom worked for the state. She receives a pension. She is still able to collect Social Security because her entire life she was paying into the system. Less and less people end up being affected by the government pension offset provision.
I think this is an applicable question for most people on the call today. As an independent consultant with fluctuating income annually, how can I best increase the full benefit for, I'm assuming, Social Security?
Yeah, so I'm going to answer it in maybe a little bit different way. I said during the presentation that only 3% of Americans wait till 70. And I'm not even sure from a financial planning perspective if that 3% should be waiting that long. I'm sure it makes sense that those who have the most money and are most capable of delaying are the ones who are going to be able to delay till 70. Those people, I would argue, at least many of them, financial planning tells them they'll never run out of money before they die. See, maximizing Social Security is a great notion, but in most cases, it may not be the best for your financial plan. When it comes to fluctuating income, going back to the question, it's really not a challenge once you've hit your full retirement age, because I'll remind you, once you hit your full retirement age, you are no longer subject to an income limit. It would apply to those years prior to full retirement age. And if you know that there's a chance most years, year in and year out, that you're going to blow past that $17,640 number, I would strongly encourage you not to turn it on. Again, just to be clear, once you hit your full retirement age amount, they no longer subject you to that income limit, at which point you would be able to collect and make an unlimited amount of money and still receive your Social Security benefits without having anything withheld.
All right, so we've got a number of Medicare questions coming in now, so I'm going to switch over to those. Did want to repeat the email for a maximization report on your situation for Social Security. Again, that email is kyle.leopold@rbc.com. All right, Medicare question. Does Medicare include or contemplate coverage while out of the USA?
Fantastic question. I knew we were going to get this one as I was anticipating it. With some of our greatest allies, there are some overlapping benefits, but both Advantage plans and Original Medicare allow you to purchase foreign travel riders or waivers, if you prefer a different word. They're very cost effective and certainly would be encouraged by us if you know that you've got some international travel in front of you. One other quick point to it, I have met people who have truly retired to other countries. What ends up happening is, of course, you're still Medicare eligible. You would look to purchase insurance for the time that you would be. I'll give you an example. A couple from Detroit, Michigan retired to Costa Rica. They're able to purchase some basic insurance protection through the government in Costa Rica, but they spend a couple months a year back in the States, and in those couple months is when they consume the vast majority of their health care. Great question.
Another question. How do you transition from HSA plan to Medicare when the time comes?
So when it comes to healthcare, once you sign up for something at the beginning of the year, you're locked in until something drastically changes. And by drastically change, here's what is: becoming Medicare eligible, moving addresses, changing jobs, or having children. And when it comes to retiring, most of the time we're talking about the first three. So with that being said, you will be granted the ability to get out of your HSA plan to go to Medicare when the time comes. Now, whether or not you should automatically jump to that, it's a cost-benefit analysis. So I was a little bit vague on this. If full-blown Medicare for the average person is $350 per month, that includes your Medigap policy, the answer is, well, how much are you paying for the HSA plan? And my argument would be, is your HSA plan probably has a smaller network. It certainly by definition has a higher deductible. That's why you have an HSA plan. I would ask you if the monthly cost is anywhere close to or certainly more expensive than $350 a month. I would argue that you probably would want to transition to Medicare.
Just going to jump in real quick here. One last question is what we have time for today.
Okay. Question about Medicare Part D. What would prescriptions cost if I don't take any?
So I started to mention, and I know that it's not just a Wisconsin-based call, but it's where I live. So I would encourage you all on the line to do a couple things. Reach out to the state. In the state of Wisconsin, it's the ADRC, Aging and Disability Resource Center. You can call the folks at Medicare. They can recommend drug policies for you. They will actually go to their own website. They will plug in the prescription drugs you take, and they will tell you, based upon the county you live in, what the best plans in terms of coverage and cost would be. But to answer the question directly, most states are going to have a very inexpensive plan. Call it around $30 to $40 annually, a few bucks a month. But of course, because those plans are so cost effective, they're only meant for people who don't take expensive drugs.
Great. Thank you so much. And thank you to all of the Patina Nation members that were able to join us today. Just a quick reminder, Patina Nation does offer a number of benefits. There's the Patina Nation 401k. We will soon be rolling out a Patina Nation group medical plan. And there's also a number of other benefits on patinanation.com. So I encourage you all to visit that. You'll be receiving a post-event survey in your email and sometime in the next hour. And then if you have any feedback or unanswered questions for a presenter or would like to receive the Social Security maximization report that we talked about today, Feel free to reach out to our 401k advisors, Kyle and Jonas, and their email addresses are on the screen there for you today. And thank you all so much for joining us.
This has been a presentation of the Patina Nation. To watch more content like this or for more information, please visit us online at www.patinanation.com.